Hi YouTubers, it is Saturday the 9th of November, so I am 6 weeks and 1 day post-op from my double jaw surgery and genioplasty. It's been about 2 weeks I think since I made my last video, so I thought I would just give you a quick update as to how I am and how I'm progressing. I'm pretty good actually. There's not been very much to say. I'm feeling really well in myself. 6 weeks and 1 day since I had my operation. I have been back at work for 2 weeks and I'm pretty much into a normal routine now. The only thing I'm probably not doing that I would normally do is exercising, because I got quite a lot of I would say I feel a little bit tense around here, and the vibration, I tried running after my little boy at school last week, and the vibration of me running, I feel like I'm jolting and it's hurting a little bit, and so I've been a bit afraid of doing that. So that's the reason I've not really been exercising, but I do want to get back into a routine of doing some exercise, because I'm feeling a little bit lardy, to put a finer word on it. I've had quite a few people saying to me, oh, how much weight have you lost through having your surgery? And actually, all the weight that I did lose in the first couple of weeks, whether that be down to the fact that I wasn't eating properly or the fact that I had such an upset tummy after the surgery, it's all gone back on again. I'm exactly the same weight now as I was before my surgery, but because I haven't been doing any exercise, I'm feeling it more. I'm feeling less toned, and a little bit wobbly in areas, and unfit. So I want to start exercising now. The reason why I think I haven't lost weight when I really thought that I would, is because of what I'm eating. Because my jaw wasn't wired shut after the surgery, because I didn't have the bands on to keep it shut after the surgery. As soon as I can open my mouth wide enough, which was like a few days afterwards, to get a spoon in, albeit a tiny baby spoon, I was starting to eat things like mashed potato, porridge, Weetabix, rice pudding, anything that I could just get in my mouth and swallow really easily. And so 6 weeks down the line, I'm eating pretty normally, I would say, everything that doesn't need chewing, because I'm still not chewing. So I'm having cottage pie, I'm managing roast dinners, so long as but not the meat, so long as I can mash the potatoes down and the vegetables are cooked quite softly and I can put lots of gravy on it. I'm eating curries, I'm eating chilli and rice, I'm eating pasta and sauce, I'm eating rice pudding to snack on, yogurts, I'm still having fruit smoothies to try and get some fruit inside me, lasagna. So I'm eating all that kind of stuff, but it's all quite calorific. I'm not able to eat salads like I would normally, fruit like I would normally. So everything that I would normally snack on or make a healthy meal out of, like a nice salad with a jacket potato and a chicken breast or something, I'm still not able to eat that, because I'm still not able to chew or put any pressure on my teeth at all. So I think that's why I've gone straight back up to my pre-surgery weight, but I'm feeling a little bit lardy because I've not been able to do any exercise. So I think I need to take stock of just what I am snacking on and try and get a little bit of exercise done. So that's my plan for the next couple of weeks, start doing some exercise. As for everything else, I've still got this irritable irritation on my skin. My skin feels quite tight, and every so often I get a feeling of little ants crawling across my skin, which I think is probably the nerves tingling underneath my skin and trying to come back to life, or the bruising's gone down on them. The neurogenic skin rash made a reappearance this week, which I think has got a lot to do with the fact that the sensation is starting to come back on this side especially. I've got all sensation here on my left hand side. I've got all sensation, full feeling top lip, sensation here. In fact, when I stroke my chin there, I get the feeling like someone is scraping something along the inside of my lip, which is a bit weird. So presumably that's got something to do with the nerves repairing themselves. But this side, on my right hand side, it is completely numb. The skin is completely numb. The lip is completely numb. But I have noticed this last 24 hours or so that when I touch there, it's starting to send little sensation feelings to the inside of my mouth, to the inside of my bottom lip. So I'm feeling a lot more confident now that I'm going to get some kind of feeling back. It's been quite disturbing having no feeling just here and this side of my lip and this side of my chin. And I know I'm only 6 weeks down the line, and they say you need to give it a good 3 to 6 months before you can determine how much feeling you're going to be losing out on post-surgery. But it is quite frustrating and disturbing. The longer it takes for the feeling to come back, the more I worry that it's not going to come back. So I'm quite nervous. I have been quite nervous, but I'm just really pleased that now I think I am getting some sensation, and I'm getting lots of twinges, lots of little pulses and things. So I'm just keeping my fingers crossed that things are starting to repair themselves within the nerves in my face, in my chin and my lip, because at the moment I still feel like I'm recovering from about 10 dentist needles. And I think that's about it really. Now that I'm back at work, and I'm seeing people at work and I'm talking on the phone, and we have visitors who've come in who I tour around, work in a big school, and I tour them around, and I've done that a couple of times this week, and I've noticed that after doing that and spending quite a lot of time with them and talking to them, I'm getting an awful lot of achiness in this area here. And I presume it is just because my jaw is getting a little bit more action. I'm talking more, so that's been aching, but no pain whatsoever, just an aching feeling. I haven't been chewing, although when I did go to see my orthodontist a week and a half ago, she said that I can try and bite down on soft food if I feel I want to. And whilst I have been getting an overwhelming desire to clench my teeth and just bite down on my back teeth, because I've not been chewing anything, and so that comes over me sometimes, I have tried to bite down on really soft things. Like I had an omelette. I went out for a lunch yesterday with some friends, and I had an omelette, and I just put a piece of the omelette in the side of my mouth and bit down on it just to try and chew a little bit of the soft cheese in it, and I just couldn't do it. The sensation of biting food onto my teeth is really odd, and I think as well because I have some stitches in the side of my cheek that still haven't come out, it was a little bit sore, and so I think maybe 50% of me not being able to bite down on my back teeth is due to the fact that I'm too nervous to, and 50% is because of the discomfort. So I'm going to give that a few more weeks. I'm seeing my orthodontic consultant again on the 18th of December, so I've got a good few more weeks yet to have another go at that and discuss that with her when I go in. Speaking of my stitches, only 1 or 2 of my stitches have come out that I've noticed. I have noticed that I can see the stitches more now, going all the way around the bottom of my gum line and all the way around the top here, where the inside of my lip meets my gum line. And I don't know whether that's because they're dissolving through the skin and they're coming to the surface. But I might be able to show you. You can just see them down there. And I have them at the top as well. And inside. And yeah, so only 1 or 2 have come out, but it's almost, I can tell now where they've started this stitch here and they've kind of loop stitch, tied it off in a knot, and then from this side loop stitch, and then tied it in a knot. So they're not lots of individual stitches from what I can see. So I think that's probably why they're taking such a long time to come out, because my surgeon said they should come out after 3 or 4 weeks. Well, I'm 6 weeks and 1 day down the line and they're still there. So I think that's about it really. I've had a couple of nights out. I've enjoyed a few bottles of wine. Been to a friend's house for dinner. Out with the girls for lunch. A night out at a concert with my husband. I went to see Russell Brand. Brilliant. Absolutely brilliant. I laughed so much. Last Saturday night, when we went to see Russell Brand, I laughed so much at his Messiah Complex gig that, all the next day, my face and my jaw really ached so much, but it was so worth it. He was brilliant. And yeah, I think that's about it. I think all really positive. Can't wait to start exercising. Can't use my surgery as an excuse for anything anymore, because I'm over it. I really think I'm over it. I feel great. I'm really disappointed that I've had to cope with this spotty skin condition, which is I know is caused by the irritation in all my nerves waking back up again, and all of the tingling. I just have really sensitive skin, and that has really bothered me, and I just wish I hadn't got that to cope with, but it's a minor thing. It's a really minor thing, and I managed to camouflage it with a bit of makeup, and actually until you get really close up you can't see it, just all the bumps under the skin. So if anybody's got any questions for me about the stage that I'm at, or my experience with having all of this treatment done at a brilliant but NHS hospital, then please let me know. And just before I sign off, I'll do some stills for you, and I'm going to update some photographs as well. I'm going to try and sort out a timeline of photographs, so you can see from pre-surgery, day of surgery, right up to today, because I think that will help anybody who's getting ready to undergo this surgery understand, or help them plan for what to expect as to how they're going to look and feel. Just one thing before I do go. I have been concerned about being a little bit lopsided, and I did query that at the hospital, because this side of my face felt more square to this side. Part of it is down to swelling. I am still a little bit more swollen on this side, but part of it is down to the fact that I have a little bit of a lump on my jawline here, which I don't have on this side. And they've checked my x-rays pre-surgery, and it's there pre-surgery and it's there post-surgery. It's just a little bit noticeable now because my jaw position has changed, and that's why it's a little bit more noticeable. But the only time I can really tell is when I look straight into a camera lens, when I've taken a photograph of myself, or somebody else has taken a photograph of me and I've looked straight into the lens like I am doing now, and it just looks a little bit wider there than there. But if I'm clever, because there's no saying as to whether that's going to even itself out. In fact, I'm not expecting it to. And the more I look at people, the more I see that their face might be slightly wider one side than the other. So it's funny how you start to look at people slightly differently when you're thinking, oh, does that person have a symmetrical face? And so I learned a little trick in that just don't look straight on into a camera lens. Tilt your head a little bit, or look that way a little bit. Give a smile, give a tilt, like that. And then it's not that noticeable. So here we go. This is me straight on. That's the left hand side of my face. Straight on again. And the right hand side of my face. With me biting together. I'm very, very happy with my profile. Very happy. The only thing that I need now is for this feeling to come back in this part of my lip so that I can put lip gloss on without having to look in a mirror. And I'll be even happier. So I'm going to sign off now, and don't know when the next video will be that I make, because I'm not quite sure how much they're needed anymore. But one final thing that I did want to say about cleaning my teeth. I did try to clean my teeth with an electric toothbrush, and I couldn't bear the vibration on my teeth. And no matter how I held my head, and I just couldn't do it. So I'm still using the baby toothbrush at the moment to give them a really good scrub. But I really do need to try and use the electric toothbrush so that I can use the interdental brush to get all around. But I just can't bear the sensation of the vibrating brush along my teeth at the moment. So I'm going to give that another go next week and see what happens. So yeah, anybody got any questions? Good luck to anybody who's watched this video and is about to go through the surgery. You'll be absolutely fine. 6 weeks and 1 day. It flies by and you will be feeling about 98% normal. Okay, YouTube. Bye bye.